Blog Talk Radio.
Hi, and welcome to Linda's Conscious Talks, and I am your host, Linda Summers, and we've got a great show for you today. Our topic is naturopathy medicine, how we promote the body to heal itself with Dr. Joseph Dubroff. And before we get started, I'd like to give you a little bit of background information about Dr. Dubroff. He received his bachelor's in biology at the University of Massachusetts in Boston in 1997. He attained his doctorate in naturopathy from the National College of Naturopathic Medicine in Portland, Oregon in 2002. Naturopaths are recognized as primary care doctors in the state of California. Dr. Dubroff is an alternative doctor and practices a three-pronged approach to holistic medicine. Scientific evidence-based botanical nutritional medicine stimulating the individual's natural resources to heal and diet and lifestyle to promote and ensure health and wellness. Dr. Dubroff completed a year-long residency in mental health and homeopathic applications during his schooling at NCNM. He has given many lectures in the community as well as hospital and other medical settings. He has also designed a year-long CME course on alternative medical applications for mental health professionals. Dr. Dubroff started his clinical practice in Portland, Oregon, where he served as a preceptor doctor training students in homeopathy for NCNM. He moved to Los Angeles in 2007 to work with an orthopedic surgeon for 2 years before starting his own practice in Orange County and San Diego County. And with that, I'd like to welcome Dr. Joseph Dubroff to the show.
Hi, Linda. Thank you so much. Hi, how are you?
You're great, thank you. Can I refer to you as Dr. Joe? Because I've called you that before in the past, and it just seems kind of natural to do that, if that's okay.
Yeah, that makes sense.
Yeah, perfect. Well, I kind of really want to get started with asking you, what is naturopathy medicine?
Sure.
Don't have any idea for that, what that is.
Yeah. Naturopathic medicine is just a system of medicine that looks ideally to heal the body, to stimulate it, to move its energies, to rebalance its state. You know, we do a number of different things as far as medical systems to accomplish that.
Is it actual medicine, or is it through herbs, or?
Yeah. It's a lot of things. On one sense, you have clinical nutrition. You have something called constitutional hydrotherapy, applications of water. You have classical homeopathy meant to stimulate the system to rebalance itself. You have hormones. You have different botanicals, different kind of diets, detoxification, different pain management procedures that I do quite a bit of, such as prolotherapy. So there's a lot of different applications. It really matters what you're treating.
Right. Well, I know that you've got so many things that you do. It's quite interesting that you can bring all of these together in one setting, so to speak. But you mentioned a three-pronged approach to holistic medicine. What is the is it the three-pronged approach being the botanical nutritional medicine, or what is that?
Yeah. When I say three-pronged approach, what I mean is basically one part classical homeopathy and/or craniosacral therapy, which stimulates the body to heal. Another division is what's called functional medicine. So, I might use a number of different tests to evaluate different organ systems and what we might need to do from a biochemical standpoint, but I'll apply more natural substances that have a much safer profile, such as botanicals and nutrients, as well as diet and other systems like hydrotherapy. So clinical nutrition and lifestyle would be the third aspect of my medical system.
Awesome. That sounds really cool. So when you, does someone have to be, because I know that I have come in to see you, so I don't know if the listeners have an idea, but do you have to have an ailment, or can someone just come to you because they think maybe there's something might be going on, they're not really quite sure? Because for myself, I didn't really have symptoms, but yet you were able to help me.
Yeah, I mean, definitely. Most people are coming in with some idea of what they want to get across, but I do wellness checks, and sometimes people are just looking for a natural doctor, and they're coming in to kind of touch base with me. So they don't necessarily have something really concerning. But most of the time it's some kind of ailment, something where they haven't been happy with what they've seen in the conventional system, or they want something that will heal them as opposed to, classic statement of a Band-Aid therapy.
Right, which I think, for me personally, I think to do anything natural is a much better way to go if we can do that. So I think it's really educating.
Yeah, I mean, Hippocrates was the father of medicine, and he talked about first doing no harm, and helping the system to heal. So there's when you take the Hippocratic Oath, which all doctors take, the idea is you start at the safest application medically to help a person to heal, and you move to stronger forms. And when you're talking about a stronger form, you're talking about medicines that can control the system and therefore have a higher chance, also considering they're synthetic, that they might damage the system. So whether you're a conventional doctor or a natural doctor, you're still taking that Hippocratic Oath, which is really how do you get the system to heal itself, which is an important concept.
Exactly. So let's talk about that, because what I was going to ask you too, really, I can really ask, since you just mentioned that, we'll go there, and then I can ask you this other question that came to mind. But
sure.
How can one promote the body to heal itself? How can we do that?
Oh, many, many ways. I mean, whether you're, one of the primary things I use is classical homeopathy, nutrition. I love meditation. It's not something I talk to people as much about because it's just a little more intensive, and it's the same thing I would recommend people seek out someone that does that specifically. But the idea is to stimulate the system to rebalance itself along the lines of how it's out of balance. That's kind of the classical homeopathic system. And then you're also asking, what is it? What sources of health would promote the change you're looking for? So, looking at lifestyle, looking at clinical nutrition, looking at different ways to increase circulation in the central nervous system, like craniosacral therapy or hydrotherapy with moving blood and detoxifying organs. These kind of aspects. Classical homeopathy takes more explanation. It's quite miraculous onto itself. But these are some concepts that would, get the job done.
Well, that was my next question. So how effective is this? How effective can it be for people who have never had the experience of naturopathy medicine?
Yeah, it can be mind-boggling effective. I mean, one of the things I love to treat is anybody with fibromyalgia. I think I have about 20 cases, and I feel, I don't want to use the word cure because, things can come and go from a minor component of what's left, people's susceptibilities. But like 18 out of 20 of those cases, for all intents and purposes, were a curative response. And, so I've got all sorts of different cases where it'd be, bleeding throughout the month for a woman, even psychosis, all sorts of cardiovascular issues. So it's very surprising. Even I don't think I was even ready to understand just how effective it could be. And I think that's a normal, consideration that an individual would have. But I think if they just open their mind up to the possibilities, they're going to be really surprised about what's possible. It is quite surprising.
Yeah. It's so fascinating. So when you have each of these different cases, do you treat them, this is kind of a weird question, but do you treat them the same? So if 4 people came in with fibromyalgia, and I probably don't know the answer to this question, but do you treat them the same?
No. I mean, the first thing you do, and my initial intake's a 2-hour intake, and that'll kind of tell you just how much I'm looking at the system, but I'm looking to understand how they present. Whether you're talking about functional medicine and knowing what tests, or whether you're talking about classical homeopathy or any other system of medicine, the more you know of what's going on, the better that you can apply medicine that is meant to help the system to heal. So, especially systems like fibromyalgia, there's a host of different symptom responses. So, considering that and caning your medicine that would, take into consideration the complete system or the complete symptom, and maybe the complete symptom is somewhat in digestive function, somewhat in pain management if we're talking about fibromyalgia, sleep irregularities, or it can be almost anything. Then that will shape, especially from a classical homeopathic standpoint, what medicine you're going to give them. And the same is going to be true of clinical nutrition and botany. I'm going to be trying to be a minimalist from any standpoint that you look at. So ideally, applying one classical homeopathic remedy, starting off with a few clinical nutritional recommendations, and trying just to do one botanical or one nutrient or several that I think really hit the heart of the matter as far as supporting the system as I'm trying to get it to remake itself back into a state of health.
So it sounds like it would really depend upon what you've touched on is really what their lifestyle is, what their diet is nutritionally, and just basically their lifestyle.
Well, yeah, really actually more than that. It's more of just how their symptoms promote. Yeah, their lifestyle, their nutrition is important, but when the body's disordered, instead of like in conventional medicine, you say, okay, well, somebody has diabetes or somebody has headaches, and they'll say with the headaches, the cause of the problem is vascular irregularities. So balancing that vascular irregularity will take away the headache. Especially coming at it from a classical homeopathic standpoint, we say there's a morbid state to the body, and it expresses that dysfunction through the different, biological systems contained within it. So the expression of those different states of the body, from a classical homeopathic system will help you heal. And I guess another way to look at that or to understand that, which is an important point to bring up, is in homeopathy, you're not treating with opposites like depression, antidepressants, excessive stomach acid, antacids. You're treating with similars. So you're looking to understand the nature of that morbid state upon the body, and you're trying to introduce something to it that has a similar picture in a very diluted preparation to help the body retune itself. Now that's really only talking about classical homeopathy. And like I said, there's functional medicine and there's lifestyle and nutritional interventions. But the point is it's much more than just saying, okay, I'm going to give you a remedy for your vascular instabilities that are causing your migraines. It's much more comprehensive in general. You might find that they have certain allergies, by doing a thorough history and recommending, a white blood cell test to assess, what might be increasing, inflammatory burden upon the body and producing headaches.
Incredible. It's just amazing. I mean, what I really got from that, too, is what you're really saying is that it's getting to the core issue. Because, I feel that in your typical medical field, not all, but it's like, oh, well, here, you're having depression, or, well, you're having this, so here, let me give you a prescription for that.
There is no core issue.
Yeah.
There isn't really any core issue. And, I love, conventional medicine, but its strength, and you can see this very clearly from it, it has to know a single protein problem or issue, So infectious disease, surgery, it knows what to do here. But if you're talking about any chronic health issue, its ratios just fall off the cliff. And that's because the system doesn't realize, the conventional system doesn't seem to realize that the body is struggling to rebalance itself, and it needs aid, it needs direction. But to give it aid and to give it direction, you have to increase components to health, such as remove any inflammatory foods by finding them through a test, through hydrotherapy to stimulate detoxification and help stimulate the immune response. You have to find a very good homeopathic remedy that will address the exact nature of that imbalance through the presenting symptoms. And when you do that, you can give the body what it needs to heal. And it's an amazing thing. It's hard to understand. I've seen it with cancer and psychosis, all sorts of stuff, and it's a beautiful thing. Oh yeah, it's amazing. So I was excited when you asked me to talk, just for that reason, get a chance to express that and let people know it's possible.
Yeah, exactly, because even, just not knowing what's available and what's out there, that there are other alternative ways to be able to help with assisting, like you said, really guiding the body and bringing the body back to balance and kind of assisting it to do what it normally, naturally is what to do.
Yes.
So go ahead.
Well, I would just say that, that's not to mean that I wouldn't use conventional medicines. I mean, our scope of practice is a little more than a nurse practitioner. We look like nurse practitioners, but we can apply some synthetic medicines on our own, anything that's considered natural. But in surrounding states, we look identical to MDs and DOs, and that's what we're looking to do in Sacramento right now. We're on the floor of the Senate right now, and that would be something I would integrate. First start with the safest protocol, a protocol that's going to stimulate the body to heal. Use safer medicines that don't have bad profiles. But I'd be very happy to have those stronger medicines as well, because they can be very needed in certain cases as well. I guess I just wanted to throw that thought in there.
Definitely. I don't think I wouldn't definitely outrule Western medicine by no means. I think we still need it. But I feel that if there's things that people are dealing with that, they can take another alternative approach and find another avenue to go to, that the word I get is safer. Maybe that, I feel that's kind of a really good route to go.
Yeah. I mean, if you just take diabetes alone, which I've been really, really successful, and I wanted to treat more of it. I just haven't been given as much opportunity as I would like. I've got a bunch of botanical medicines that have research to work, like metformin, if anyone has diabetes and familiar with that. But if you look at the research on metformin, you see lots of complications with that medicine, and you see it harming, insulin responses, which is what type 2 diabetes is a loss of cellular response to insulin. Therefore, and insulin pushes sugar into the cells. So when you lose that response with insulin to the cells, you gather up blood sugar. So hence, we find something over 100. Over 125, over 150, and if we're up to like 400 or 500 in our blood sugar, we're going to the hospital. But the issue there with natural medicine, just to speak from a biochemical standpoint, I can give something like berberine that has research to be equivalent to metformin, and then I can give a whole bunch of medicines to help strengthen the insulin response. And one of the reasons I think that so many diabetics end up on insulin is because, I don't know this for sure. I know there's plenty of research for it, but that metformin further causes insulin sensitivity problems, and therefore lead people in such a direction as that they're not going to turn around their response, even with, halfway decent clinical nutrition. And that's information people should know. They should have a full. They should be exposed to, full set of choices, and you want to monitor them very closely, but you want to monitor them, and if you don't give choices, then you're not really practicing the Hippocratic oath. And
absolutely, and that's what it's all really all about. It's having the choice of being able to decide where we want to go. I think that's
and knowing
awesome.
knowing that you can take a certain road, try it for a little while, and if it doesn't respond, well, that's not what we want. Or you can say, okay, well, I'll try a little of this, and I'll try a little of that, because, and you can take this from an antibiotic standpoint. If you only deal with infectious disease through antibiotics, you're also going to do some harm to the natural flora of the body, and perhaps set yourself up to lose your ability to use antibiotics because you've used them so much, probably in cases that aren't appropriate to use them, that, if you do get something really bad, from an infectious disease, all of a sudden you have a more limited use of, antibiotic medications, which are very important. So, having a more comprehensive program is important. And when you look at research for natural medicine in the surrounding states, that's what you see is huge savings to state healthcare, we do things so cheaply too. We're not using as much, big pharma and big costs, because we can use clinical nutrition, hydro, very cheap botanicals, and a lot of the time people are buying those things themselves as well.
What is a botanical medicine?
Botanical medicine is just using plants, really. So,
okay.
It's the medicine that came before conventional medicine, and not bloodletting and things like that, but, that history of medicine has been around for thousands and thousands of years. I think the Chinese medical system is the oldest that we still use regularly in systems of medicine.
Right. Interesting. So was there something that caused you or something in your own life for you to take this path of being a naturopath doctor?
Yeah. I mean, originally I had some digestive issues. I had some depression issues, which, clinical nutrition, botany, and especially classical homeopathy made an amazing improvement in both my digestive and my depressive symptoms, as well as I really wanted to see. I really just wanted to see something where nature was involved more with people in general, where communication was something to be favored, and something that I felt could bring about a cure, which I kind of had an view that it had to be something a little more than a single drug, which I think a lot of people do have that view. They just don't know exactly what to expect.
Which they always say out in nature, really, that's where you find. I mean, look at the indigenous people. They everything is from the plant kingdom.
A lot of conventional medicine. Yeah, a lot of conventional medicines are from the plant kingdom, like aspirin is from willow bark. You have beta blockers. The original beta blocker was something called Rauwolfia, which is a plant, you have all sorts of medicines, that do that. And a lot of medicine systems weren't taken on by the conventional systems, such as the slippery elm is great to coat digestive membranes and prevent burning through your GI tract with acid. And it really brings on a lot of relief and kind of works simply like, almost magic, because it's just so unfamiliar to people that option is even there. Usually you're just using proton pump inhibitors, which really also have a lot of research to cause problems. You could just look at it and think about the sense that is it a good thing to always inhibit the stomach acid without asking where it is, or letting the body if you're suppressing some important function like acid to digest, perhaps it moves the body away from managing its own system and healing a more comprehensive issue as opposed to acid and antacids. That's a very simplistic view that the body is only an acidic problem that should be solved by antacids. That's all it could be. Seems short-sighted to me.
How would we know before it gets to that point of no return, so to speak? Before it gets to that heightened stage, I know that we sort of have this intuition, this inkling of something's not right. So could someone come into you at that point and say, kind of like what I did in a way?
Definitely.
How would we know when to really seek out? Because we don't really know what's happening in our bodies. We have this idea that, something's not right. We just kind of go on with our lives. And I'm speaking for myself.
Yeah. That's one of the, like I said, getting back to the fact that we're in Sacramento right now, everything goes well with that, and goes well with the chiropractic efforts to increase insurance. I'll be able to take insurance. So, for some people it's a matter of putting the money down on the table because I'm a cash practice. You might get reimbursement on your PPO, but for a lot of the time it's not. So a lot of times people don't come in until they're already sick. But I think it'll be a lot easier once there's insurance, like the surrounding states. And from that standpoint, there's just no comparison because, for instance, one issue that the conventional system really applies is that, if there's nothing on my labs, and there's nothing in your body. Where, for instance, back to classical homeopathy doesn't look for a diagnosis. It is very concerned with what your symptom is, but for it to treat your symptom, it's not the common feature that we call the symptoms, such as asthma and constricted airways or allergic responses. That's kind of the genetic disposition of reactive airway disease or asthma. In homeopathy, you're looking to say, what makes better, what makes worse, what comes along with the asthma, sensitive to cold, sensitive to heat. When you get asthmatic, you get pains on the sole of your feet. And it's these kind of symptoms that define the medicine you're going to give. And therefore, because you're not defining the medicine you're going to give based on a diagnosis per se, it doesn't really matter if I or any other well-trained homeopath, classical homeopathy, knows what the name of the disease is. Therefore, you can come in any time, and we're going to be able to stimulate the system to find the balance it needs to handle, something that's going wrong, quote unquote, functionally, that isn't showing, pathological tissue or clear imbalances in blood labs, which, mind you, only go so far in assessing really what's going on in the body.
Right. Well, we've got 3 minutes left, so I have the question to you is, and plus I want you to be able to give your contact information, how people can get a hold of you, our listeners, and then also the people who will be joining us afterwards, just because they weren't able to be on the live show to see the video. So what is one thing that you could share with us that has helped you on your journey?
Wow, that's a hard question. On my journey to practicing medicine, or
just on your journey to really awakening your own awakening on your journey. It could have been your incident of your digestive, your medical. It could have been.
Yeah. I know how to answer that, but it's not going to be the classic response from a doctor. For me, something that's been very important to my life. It's a strange statement, but is that we all have an idea of what reality is for us, and that's very important. But there's a truth out there, and I'm not talking about an organized religious truth. I'm talking more about what we can know and can't know. Like we all jump up, we all fall down. It's gravity, and within that, it's important to pay attention to that greater truth amongst us. I think when you do that, it makes it easier to do everything and bring it back to medicine, including sitting down with someone and not just hearing their symptoms, but sense something that will lead you to the heart of the matter, which is very important, because people might not necessarily bring out every symptom that will get you there. So you have to know when to connect what you're feeling in them with the symptoms they've told you, and know that makes sense, that you're there.
Right.
Yeah.
Wow, that's incredible. Absolutely. I love it. So how can people get in touch, our listeners get in touch with you?
Sure.
Website or,
Yeah. Well, first of all, my phone number is 949-444-4884. Pretty nice number, 444-4884. I'm in San Diego and Orange County, even actually in Temecula now. And my website is holistic, HOLISTIC, solutions with an S, doc.com. So holisticsolutions.com.
Perfect. And all this information will be at the end of the video as well. So if people were not able to get that and write it down, I will have all, and I can get your email and whatever else information you want to have on there. So, well, thank you so much for being on the show. And actually, we're going to have you back the whole month. So we've got, a lot of really great topics, just really letting all listeners know what's really happening. So thank you so much for being on the show, and I want to thank all the listeners out there who joined us today and the ones who will be joining us afterwards via YouTube. Please follow, subscribe, comment, and like us, and join us next week with Dr. Joe on June 8th for our next show, which will be The Body Can Heal Itself, Transforming the Placebo Effects into Real Medical Treatment, again with Dr. DeGroff. So thank you again, Dr. Joe. I really appreciate it. I look forward to Monday and having another great conversation. So thanks so much. I appreciate it.
Thank you so much. I look forward to doing it again.
Yeah, absolutely. Then I'll see you next week. Thank you.
Thank you.
Bye.